Today is April 24th, 2013, and my name is Carol Turner. I'm interviewing Linda Weber, who set up the original abortion counseling program at Boulder Valley Women's Health, the first abortion clinic in Colorado, established in 1973. Linda is also the author of Life Choices, The Teachings of Abortion, published in 2011 by Sentient Publications. This interview is being recorded for the Maria Rogers Oral History Program. The interview is being filmed by Donald Dick. And let's get started. First of all, can you tell me when and where you were born?
I was born October 28th, 1944 in Los Angeles, California.
And why did you come to Boulder, and when did that happen?
I came to Boulder from New York City. So I was only in Los Angeles until I was barely 6 years old. I came to New York City, to Boulder from New York in 1972 after spending a summer, 3 months in 1971 here. And I came because of a relationship with somebody and because I needed to get out of New York City badly.
And how and why, what were the circumstances that kind of got you involved in the whole subject of women's issues and abortion? And
I was involved in women's issues before I came to Colorado. I was part of the women's liberation movement in New York City, starting in 1969, which is the year that my second daughter was born also. So I had two very small children, as well as being very active in the women's movement. And then in New York State, the abortion laws changed in 1970. So there was a repeal of the abortion law in 1970 in New York State, and so abortion clinics began to appear right away. And I got involved in counseling and being a doctor's assistant there in 1970.
so that was before Roe v. Wade, then?
That was before Roe v. Wade, and so it was a very different situation where abortion was illegal in almost the entire rest of the country, not the entire rest of the country, but almost. And so I came here because I needed to change my life. I wanted to get my young children out of New York City at that time, and that's what brought me.
And how did you get involved in the women's clinic, and what was it? Had a different name at that time, and can you kind of talk about those early days and what sounds like it happened pretty quickly right after you got here?
It happened relatively quickly. I got here in March of '72 and moved up to the mountains from my very warm New York City apartment to my little cabin in the mountains with coal heat. It's a big, big change.
Like
ward? At that point,
or?
I was taking downtime from having worked at the abortion clinic in New York. But I did find out relatively quickly that there was something called the People's Clinic that existed in Boulder at that time, and that was really operating with lots of volunteers, and that Colorado had a liberalized abortion law at that time. Actually, Colorado was one of the first liberal abortion laws. It was still restrictive, but it was possible to get a legal abortion in a hospital with the consent of two psychiatrists in Colorado at that time. So I became a volunteer counselor at the People's Clinic for a brief time in end of '72 into '73, where I would just go as needed if there was somebody who needed to talk about their situation and get a referral to get an abortion.
Like abortion-related situations?
Right,
or
right.
just
Counseling about the pregnancy, counseling about what to do, counseling about what's available. So I had to learn what was available in the state, and then I
Do you remember what that was? What were the restrictions?
Well, basically you just had to have the letters from two different psychiatrists saying that you were unfit to be a mother.
Oh, wow.
In order to get an abortion. I mean, I'm doing it in a nutshell. You know.
Yeah.
That wasn't their language, but that's my language. The psychiatrists who were writing those letters were mainly trying to help the women. They really were not diagnosing them in any kind of pathological way. They were trying to help them get their abortions.
Wow. Do you remember who those people were, any of those psychiatrists?
One of them was Erwin Sklar, who went by the short name of Rand. Rand Sklar is how we knew him.
Rand?
Rand, R-A-N, it was his nickname. And S-C-L-A-R, I believe. Really good man. And he was a practicing psychiatrist here in Boulder, and he was one of the people who would write those letters. So he would, you know, when he interviewed a woman to help her with the Colorado law and how to negotiate that, he would be very supportive. I mean, he would basically be an advocate for her, to her, in private, and help her, and then he would write the necessary letter to get her an abortion in a hospital. And I think it cost $500 at that time, which was a lot of money in 1972 and 73. So that's what I was doing as a volunteer. I didn't see a lot of people, but you know, every once in a while, People's Clinic would say that somebody wanted counseling.
Do you remember, were these like street girls who didn't know about birth control, or do you have any sense? I mean, it was a while ago. So.
I don't remember who they were, but my overall experience is that women who need abortions are just women who need abortions. They don't really fall into any category, but the People's Clinic did serve primarily the kids on the street, the younger people on the street. Street freaks, they were called.
Right.
It was called a free clinic. It was, in some ways, and probably mostly free. But I wasn't involved in the actual administration of People's Clinic, so I can't tell you exactly how it ran. But it was a hole in the ground. It was a basement. It was a down under space.
Yeah. Do you remember what the law in New York was at that time, as opposed to the one in Colorado?
Sure. The Colorado law was earlier, 1967. You know, and so it was one of the most liberal laws in the country, and so was Washington State and Hawaii and California. But New York State trumped them in 1970 by repealing all of the laws that made abortion illegal. So it was basically on demand.
You didn't need to prove that you were unfit.
You didn't need to prove anything.
Wow.
In New York State.
And I'm trying to remember exactly when Roe v. Wade, was it March of 72 or something like that?
January of 73.
January 73.
Yeah,
okay.
January 22nd, 1973.
Wow.
Yeah, so it just celebrated 40 years, just this year.
Wow, 40 years of Roe v. Wade. Do you have any sense of how many, after Roe v. Wade, you know, were clinics suddenly sprouting up all over the country, or did states, I imagine some states, instantly said no, not here, or no, or what was the aftermath?
The states couldn't say no, not here. The Roe v. Wade made abortion with certain stipulations legal throughout the country. So yes, clinics did start popping up all over the place, just like what happened in New York State. In some areas it was easier to start a clinic than in other areas. Here it was relatively easy because the community was basically liberal in Boulder and pretty supportive. I mean, there were people who were not supportive, but they weren't actively unsupportive. So when the community got together to start what was called the Boulder Valley Clinic, that's what they named it at first, this small group got together to start that. Do you want me to talk about that?
Yeah, do you know the people's, do you remember their names, or who the main players were?
I remember some of them. The main players were Roger Wade, Bob McFarland, who was a general practitioner, internist type doctor in town. He started the People's Clinic. He started the methadone program. And he started the parenting place, as well as helping to start the Boulder Valley Clinic, which then became Boulder Valley Women's Health Center. And so he was an activist health practitioner.
Right. Did you know McFarland? He's pretty famous around here.
Sure, I know him.
Yeah.
Not personally, but you know, I knew him enough. And yeah, he remained an activist until the end.
Yeah.
And then, who else was involved? Marilyn, whose name I'm not pulling at the moment, but we can find it if you want it. And Pater Lund. These are people who helped to fund the clinic as it was starting.
Pater?
Pater.
Or Pater, P-A-T-E-R?
Lund. But, you know, we can get the spelling of the names another time, because I'm not sure I've got it all right with regard to them. I was not involved in the ground floor beginnings of that. Warren Hearn actually was found by Bob McFarland to be the first doctor at Boulder Valley Clinic. And so he got involved after they started their community organizing. Sherburne McFarland, who is still alive and retired OBGYN, and his name is spelled differently. It's MACFARLAN. He was of great support to Boulder Valley Clinic, not intimately involved in terms of the board, but he was a major supporter of getting it started. And they all knew each other. Rand Sklar was also on the board at the beginning. And what happened is that there were, as I understand it, my memory is that there were 10 people, I've mentioned some of them, who were all willing to put up $1,000 so that they could raise $10,000 to get the clinic started.
Oh, wow.
And that's all they needed to get it going.
And then they rented a building, or do you know?
And so then, so that was in early 1973 that they got together. And then sometime in the summer, I found out through word of mouth, the grapevine, whatever that was, because I knew that a clinic would start, just because I had gone through what I went through in New York. And so I had my ears peeled, you know, it was like, okay, let's find these people. I know they're out there, and they were, and I did find them. And they were looking for somebody who could set up what they were first calling an escort part of the service for the medical service. Instead of counseling or advocacy, they were calling it escort. And Rand Sklar, the psychiatrist, was on the board, and he's the one who interviewed me to see if they would hire me as the counseling person, or head counselor, I think they were calling it at that time. And I talked with him about not using the word escort, it just seemed weird to me. And that I was a counselor, I was an abortion counselor, and I could train other abortion counselors the way I was trained. And so I was hired, and I joined the group in September, or late August maybe, of '73, and we just were meeting and meeting and meeting, and still looking for a building, and found the building on Broadway, 2346 Broadway, and got in there and had to tear down walls and build other walls and make it so that it would work as a medical facility. And yeah.
So how, from the, maybe we may not know the answer to this, but from the sort of first meetings and the first client, how many months would you say?
We opened November 1st.
November 1st.
It moved very fast.
Yeah.
Yeah, because by the time we were all on board, and there were 5 paid staff at the beginning, everyone else working was a volunteer, so I was one of the paid staff. I can't say I was a lot of paid, part of the paid staff, but it was great to have that as a job. I'd been waitressing before that. And there were, the 5 of us knew what we wanted to do. So it was an executive director and somebody who was running the office, and then the doctor and the nurse, and myself. And
so were you there on day one then?
oh yeah.
Okay.
So
do you
I
remember? Do you remember vivid memories?
The whole thing. Oh yeah.
I'd love to hear.
The months that leading up to the opening day, we were training other people. So there were 18 women who came forward who wanted to be volunteer counselors, and I trained 18 women to be volunteer counselors.
So was there some kind of, you've got to have a degree in such and such?
No, you didn't have to have any. I didn't have a degree. I had no degree. I was an activist, and I had been a history major actually in college, and I had this perspective about sexual counseling and the importance of that, and I had a year and a half of experience in New York City where I saw upwards of 1,200 patients myself for counseling.
That's a lot.
And I learned, it was a trial by fire, and so I knew quite a lot by the time the Boulder Clinic started. And I just kept applying that. Plus, I had Rand Sklar as a backup for some of the more complicated psychological issues that could come up with people. And so we just worked together on that. But that didn't happen very often. Most people who come for abortions are normal women, not people with any sort of psychiatric problem. So I trained them to be advocates for the women, to know how to explain medical procedures, to know how to ask the right questions to help the women emotionally with any support they might need. And then we opened, and we had 9 patients on November 1st and 9 patients on November 2nd, and each counselor got 1 patient.
Wow.
Because they were volunteers and it was their first time. Some of them had degrees, some of them didn't. They just had to have, intelligence and a willingness and a strong desire to help, compassionate attitude.
So you came in that first morning and opened the doors and waited? How did you let people know what was going on? I mean, was the daily camera there, or
the
what?
camera did some stories. I can't remember the stories, but they did cover it. And
what was the tone of the coverage? Do you remember? Was it
no,
like kind of
I
scandalous
don't
or shocking?
No, it wasn't scandalous. I'm going to back up just a bit because we did have a little bit of a problem getting a building. Not getting that particular building, that was not a problem, but prior to that we had tried to get a building or a suite in the medical building on Alpine, and we were kept out by an anti-abortion physician who was practicing in that building.
Oh, really?
So that kind of tension did exist in the community. But it wasn't a big fight or anything like that.
It wasn't scary?
Not for me. I mean, I don't know how scary it might have been for other people. I don't think it was scary for the staff. We were really busy and never really had a lot of time to be scared. We were pretty excited about it and motivated because most of us had been involved with illegal abortion in some way, in one way or another. And so there was a very high motivation to make.
Can you talk about that a bit? Or?
I can, but there was a really high motivation to make the services available and safe.
Right.
But because abortion was just newly legal, most of us had been involved in one way or another. Some of us I had had an illegal abortion in the 60s, and Roger, who was the executive director, had taken an ex-girlfriend of his to Mexico, and she had almost died. But she didn't die, but it was very, very scary and awful. And so he had that experience. Ran had been writing these letters and talking to these women for years as a psychiatrist, and also really believed as a psychiatrist that the sexual counseling was crucial and important and needed to happen. And then some of the other people had had their own experiences too that I don't remember the specifics about, but they were all coming from knowing about how horrible it was when abortion was illegal.
Right.
Yeah. So we were just too motivated to be scared and too excited.
So you really felt like it wasn't just a job.
No, it was
No.
a cause. It was really a cause, and it was something we wanted to provide for the community badly. And I was excited because I had learned so much in New York, to share what I had learned with these new counselors and with the patients, and just have the kinds of conversations that you can have with women about what's going on with their bodies. And the women's movement was alive and well at the time and active. Our Bodies Ourselves, the big book on health, had just come out a couple years before that. So it was a lot of these ideas were very new.
Yeah. And what about birth control itself? Was that, you were also offered birth control services at the clinic?
Yeah. The birth control counseling was just an organic part of pregnancy counseling. It was always offered. So part of explaining the procedure for the abortion and discussing the whole decision about the pregnancy, and just helping someone not be scared about what's going on and understand. We also included the birth control counseling, so we would discuss what happened if the person was using birth control, or if they didn't have access, or they didn't know, or they didn't use it, or something happened. We would have a whole conversation about that. Yeah.
My understanding, somebody told me that you couldn't get the pill around the 1970-ish time. You couldn't get the pill unless you were married.
Well, that kind of depended on where you were. there were still a lot of prejudices in 1970 about birth control for unmarried women. I don't think it was illegal. I mean, don't quote me on that because I'm not sure what the legality was. I know in New York it was legal, and I think birth control was legal throughout the country in 1970. But there were still strong prejudices by doctors against single women wanting birth control. Sometimes it was hard. So that might have been a reason why someone would not use birth control, is they were just too embarrassed or felt like they just couldn't take the chance on buying condoms in a drugstore or going to a doctor.
Did it seem like women understood, the issues of birth control, and did they know what they were doing, or were they just sort of naive and, oh, nothing will happen? And
well, we all kind of walk around with that feeling like about things that we don't want to have happen. We think, oh, that'll never happen to me. And that was a pretty pervasive feeling on the part of many of the women who became pregnant when they didn't want to be and chose to have abortions. It's like, oh, I just didn't think it would happen to me. On the other hand, most people knew that by having sex you could get pregnant, and it was so some people really tried not to get pregnant and then didn't succeed and got pregnant. So I would say yes to people being naive just because they were young. The majority of people that we saw for abortion were between 18 and 24. They were very young. I was young. I was only 27 when the clinic started. 29 when the clinic opened. And so yes, people were only had as much knowledge as they could get, and since there was no education in the schools, no education usually from parents about sex or about birth control, people often did not know what to do. So they scrambled.
Was there a rule or a law or a policy about the age of the women that you could talk to? I mean, what would you do if a 13-year-old walked in your door?
Well, yeah, our policy was to involve the parents as much as possible. If a very young person, like a 13-year-old came in, it was very rare to see somebody that young. I mean, a 13-year-old was once in a blue moon. And usually the parent was with the girl.
Oh.
If they were that young. But even if they were 14, 15, 16, 17, we'd still ask and encourage them to tell their parents. There were times when the older teens really felt they could not tell their parents. Unfortunately, I can't remember exactly how the laws worked. There was a time when it was more open and more liberal, and then it kind of shut down, and there was more consent that had to be obtained from parents, and since I'm not working there anymore, I can't remember exactly.
Right, but there have always been sort of laws regulating these age groups and who needs to be notified.
There have been some laws in some places regulating, but not entirely all the time, and not necessarily 18. 18 was not necessarily the cutoff age. Sometimes it was 16. But I can't remember.
Yeah. I think I was one of those like 16 or 17-year-olds that came into that clinic many moons ago. I was kind of curious about the whole idea of having a separate clinic for these services as opposed to the women going to their regular doctor and all that. I mean, didn't Roe v. Wade, could they still go to the hospital to get an abortion, or do you have any sense of that, or did all of these services move to women's clinics, or?
That again depends on the state. In Colorado, there were hospitals, and there still are hospitals that perform abortions in Denver and here. There were freestanding abortion clinics being set up all over the country, and that's what this Boulder Valley Clinic was and still is. And the reason was because the services, whether or not there even were services, or the quality of the services were a little sketchy, a little questionable. I mean, you never knew exactly what you were going to get if you went to a hospital. Abortion as an experience and as a subject was taboo, and still is taboo. It's something that's really hard for people to talk about, just like it's very hard for them to talk about sex, although that's gotten a little bit easier over the years. And so there was shame involved. And for the single women, there was shame involved because they got pregnant without being married, and there was a stigma attached to that, a social stigma from our society. It was bad, and they were bad, and they could not or would not risk going to their own doctor or to a hospital because of the stigma. Unfortunately, the stigma still exists, and it's still really hard to talk about abortion for many people. So the freestanding clinics cropped up all over the country in order to meet the need. In addition to that, there was the feminist movement, the women's movement, which had a philosophy of care in women's health that did not exist in the hospitals. And the philosophy of care of the feminist health movement was equality with the patient. In other words, advocacy for the patient, and listening to the patient, and listening to what she needed, and what she felt, and what she thought about what was going on. And so there was a give and take.
Equality with the physician, you mean, between the patient and the physician?
The patient, the physician, the counselor, the office personnel, everyone. There was a lot of education that went on for each patient, because that's what the women's health movement was all about. So behind the freestanding clinics was this philosophy of women's health, and it was so basic to our understanding that we didn't really talk about it. We didn't label it. At the Boulder Valley Clinic, we didn't label it the philosophy of women's health.
Right. There's not some book out there called The Philosophy of Women's Health.
Well, I don't believe so. There is Our Bodies, Ourselves. And,
okay.
And I was coming from the women's movement in New York City, so I definitely was carrying those beliefs. So there was a lot of desire to educate the women who were the patients, and that didn't exist in the hospitals. I think it does now, and that's a result of the influence of the women's health movement.
Yeah.
You'll find in many hospitals now, and especially in a place like Boulder, a lot of patient education, a lot of talking to the person and treating the person as a person rather than as a condition, which is great.
Yeah. So these clinics have actually had an impact on sort of healthcare spread far and wide to the hospitals and regular doctors.
And there was just more freedom for us to provide the services that we wanted to provide, including the counseling.
Were the counselors all women, do you remember?
Yeah.
And were the physicians all men, or were there any female physicians?
There were female physicians eventually, but most of the physicians were male. Yeah.
Interesting. But they must have been sort of different, like McFarland, those, and this ran.
Well, Sherburne didn't actually work at our clinic. He had his own private practice. The other doctors, the doctors who came into work also had their own private practices and came part-time to help us out by performing the abortion procedures. They had to have had a certain kind of training, and that was the other thing, that in hospitals, and it was very uneven, you never knew whether the physicians actually were trained to do abortions.
Right. Is that something they cover in medical school?
Sometimes, in some medical schools. But there's been pressure from anti-abortion people throughout the 40 years of Roe v. Wade to get rid of that. So that's a problem in the country.
Yeah, and how, let's say you've got a crew of doctors who are already out practicing at the time of Roe v. Wade. Do they go back to medical school and get the training, or I wonder how?
Some of them did. Well, they don't go to medical school, they just go to an abortion clinic and talk to the executive medical director and get themselves trained. That's actually what happened in New York City. In New York City, I was hired at a clinic that was started by a man, an MD from New Orleans. I don't know if it was New Orleans, but it was Louisiana. He came to New York immediately as soon as the New York state law passed and set up a legal abortion clinic because he had been an underground illegal abortionist in Louisiana, and he had been part of a network called the Clergyman's Consultation Service on Problem Pregnancy, which was a nationwide underground organization or network of clergy from different denominations who would counsel women and refer them for abortion. And the clergy had connections all over the country with physicians who would do the abortions illegally. And so what happened is this doctor from Louisiana came and started the clinic in New York. And so the clergy were still referring to him. He trained all of the New York City OBGYNs who came to work at that clinic how to do the simple procedure that he had developed.
Himself. He developed himself.
Because he had to have a very simple, safe procedure because he was operating illegally in Louisiana. So.
Right. But it wasn't, I mean, there's different kinds of sort of illegal abortions. There's the sort of the backroom nightmare stories you hear, and then there's just concerned physicians doing it
Concerned physicians
secretly.
doing it, and concerned clergy were referring.
Oh, that's fascinating.
Isn't it?
Yeah. I'm surprised to hear that, actually.
I think there's a book written about that.
Oh, wow. So, now how long did you work at the clinic? You're not there anymore.
I started at the beginning in 1973, and I was there until 1987.
So that's
About
quite a
14
while.
years.
Yeah. Did you notice any sort of changes in the clientele during that time, or any kind of sea changes?
In the who came as a patient to me?
Yeah, who came and what the
no.
atmosphere was like, or
Well, we became stronger and stronger. We became more and more established, and we expanded our services to do more and more gynecological services, and more birth control services, and more sex education in the community.
okay. So did you start out exclusively as an abortion clinic, and then evolve to start sort of family planning?
The following year. I mean,
following year,
within
okay.
a year.
That happened
It was,
quickly.
Maybe 6 months later that we opened our first day of GYN and birth control services. So that was always the direction that it was going.
Right. Was the pill very prevalent then, or was that the kind of main birth control method? Or
No, any of the pill was a major birth control method, still is. It wasn't as safe then as it is now, but it was still pretty safe. There was still controversy about it then, like there is still now, because it's a hormonal treatment. But we gave people information about birth control pills, and we gave people information about diaphragms and condoms and foam and whatever contraceptive device came along that could possibly be helpful. But yeah, we grew, and I don't think the clientele changed. I think it was just women from the community. I did get the feeling that there was less desperation. People were still traveling somewhat from Wyoming and Nebraska and Kansas to come.
And that's because there were no clinics there?
There either were no clinics there, or they were hiding from their communities. So it kind of depended on the situation. But you know, there are universities up in Wyoming and Laramie, and people will come down to our clinic. And we were not the only clinic for long. You know, we were the first freestanding clinic, but then Planned Parenthood in Denver began offering abortion services very shortly after that, after we opened, and other clinics appeared. You know.
Right. There is no Planned Parenthood in Boulder, is there?
There is.
Oh, there is.
There's a Planned Parenthood in Boulder and Longmont that provides gynecological and birth control services, and they refer for abortion. The Planned Parenthood abortion services are all in Denver.
I have kind of an idea that the whole concept of a clinic, free clinic or otherwise, really started during that time, late 60s, and before that there was a doctor's office or a hospital, and there was no such thing as sort of a clinic, like a community clinic.
A community clinic. I think that's true. I think community clinics started during that time. I don't know a lot about the general community clinics, but I do remember the People's Clinic and how incredibly important it was, and still is. It merged with Clinica Campesina a few years ago. They were serving people who had no services. They were serving poor people. And we were doing the same. We did have a fee for the abortion services. and for the birth control services eventually, but we always had a sliding scale, and we always were working on funding, having funding sources for people who had no money. So, you know, the basic philosophy of the community clinic is you don't turn anybody away.
Right. Do you remember what the regular fee was or anything along those?
Not really. It was probably something like $125.
Oh, okay. But it wasn't 500, what the
No.
other,
Mm-mm.
the hospital fee,
And I
plus
think
the psychiatrist fee. And
No. Once we started to pay the counselors, which also happened within the first year, we raised the fee a little bit in order to be able to do that. Yeah, but we were truly nonprofit.
yeah, I'll bet.
Yeah.
As was the People's Clinic.
Yeah.
So these people who each gave $1,000 to seed in the seed money, what, you know, next year was it? Do they repeat that, or
No,
you know,
no.
what's the? Do you know much about the funding and?
Yeah,
sort of-
no, they no longer nobody had to repeat that. That was the seed money, and then it ran on its fees. It was managed extremely well. I don't take any credit for that. I was not the financial manager by a long shot. But the people who did that were, I mean, Roger Wade was the main person doing that, and he just managed it so that he was frugal and he was careful, and so it ran on its fees.
On its own fees. I mean, I know, you know, I've looked at the People's Clinic quite a bit, and that they had fundraisers and a lot of donors, and eventually started getting some government funds.
Right. Well, that's exactly what happened with Boulder Valley Women's Health Center. It did run on its fees, and then it began to have donors, and then when the GYN services and the birth control services became the dominant services, and that is the way it is now, the funding was requested and obtained from both federal and state. So they do have funding for GYN services and birth control services for low-income people. So, and then they began serving men and doing all kinds of different screenings that could be done, you know, in a sexual health clinic.
So it's not just the women's clinic.
Not only.
Yeah. What's it called now? What's the name
Boulder
today?
Valley Women's Health Center.
Boulder Valley, but men can go there too.
They can.
And get counseling and venereal disease type of things.
That's
or
right.
It's not just a general, you know, I've got a cough. kind of
No,
thing.
it's not a general clinic. It's definitely a sexual health care clinic. So sexually transmitted diseases are treated there, diagnosed and treated, cancer screenings. And that started right away. You know, when we began to do the birth control services in 1974 or 5, I can't remember the year, we were doing pap smears. And in fact, when we were doing abortion services at the beginning, we were always doing pap smears for the women coming. So, you know, there was a little extra added on preventative health care screening that was done.
I think I may have asked this already, but the sort of when you, in the early days when you were getting started, how did you sort of make yourselves known? I mean, you know, you said that Daily Camera came out and did an article, or did it just sort of happen organically, word of mouth, and the clients appeared?
It happened in a lot of different ways. Word of mouth was a big one. Letting all of the medical services in the area know that we existed, all the private physicians.
Oh, so they referred people
yes,
to
they
you.
did.
Okay.
Private physicians would refer because they didn't specialize. They didn't do women's health at all. And the word just got out, you know, and the phone book. Remember the phone book? We don't have phone books so much anymore.
Those big stupid things that keep leaving
yeah,
on
the
my
big
thing.
fat phone book. We were in there listed, and they would not, and this tells you the prejudice and the taboo, they would not list anything under abortion services. I think they listed it under contraceptive services or something like that. I don't remember exactly, but I know they wouldn't list under abortion services for a long time. They do now. But the phone book was a major referral source. The women would just look for it in the phone book.
Do you have any sense of the acceptance, the sort of community acceptance. I mean, this is Boulder, and Boulder was, you know, definitely going through a counterculture period, late 60s, but from the other sort of medical community in town, was it, oh, this great thing has happened, or was it, ooh, that icky thing we're not going to talk about?
Both. It was mixed. It really would depend on which medical person you would talk to, which doctor, which nurse. I think many medical people were really relieved that there was a service, because they knew. I mean, the hospital emergency rooms knew, because those were the places where they saw the botched abortions during the illegal times, which were, you know, just a couple of years before.
Yeah.
And so I think they were relieved. I think there were some physicians and nurses and medical people who were appalled, and who just thought abortion was a horrible thing, either from a religious point of view or just their own personal point of view. So it was a mixed bag. Yeah.
Yeah. I would imagine in other places, aside from outside of Boulder, it might have been. Is that the only women's clinic? I'm just thinking of the other towns in Colorado. Are there similar clinics?
There was one there was a feminist health clinic in Colorado Springs eventually. I don't know when they started exactly, and they're not there anymore, I don't think. I could be wrong about that, but I don't know.
But Planned Parenthood.
Planned Parenthood is a 4-state organization. Rocky Mountain Planned Parenthood covers 4 states. But yeah, at that time, it was a very new idea to have a separate women's health facility that did abortions. So the community had to get adjusted to it, but I don't think most people thought about it. I mean, you know how it is. People go about their lives, they go about their business. They pay too much attention.
It wasn't beset from the beginning by demonstrators?
Not from the very beginning, but eventually.
Eventually.
There were picketers.
Do you remember how long it took that to start up? Like years?
Well, it took years. I mean, there was opposition, like I said, you know, at the beginning, but not the kind that really tried to stop it, or that could stop it. You know, the health department required certain things, but we just did what they required as far as all the tests for sexually transmitted diseases and, you know, and how to inform partners and all that. We learned what the health department needed, and we did that. So anyone involved with public health was usually pretty supportive. But that wasn't the question you just asked me.
I don't know. I can think of another one that just popped into my head, though. George Tiller,
Yes.
the man in Kansas who was murdered,
Right.
what, 5 years ago, or several years ago now. Did you know him?
I didn't know him personally, but I have friends who knew him. And he was an extraordinary human being.
Yeah, tragic, terrible story.
Really tragic. But he's either the 5th or 6th physician murdered for doing abortions in this country. That didn't kick in until the 1980s. The really, really nasty, violent assaults on the physicians didn't start happening until the middle to late 1980s. We, at Boulder Valley Clinic, we did have picketers from out of state. Joseph Scheidler showed up, and he had a campaign like sort of similar to the Westboro Baptist Church. I mean, not exactly like that, but he was going all over the place, hollering.
In the 80s? I'm not familiar with his name.
Yeah, Joseph Scheidler, and he. So he had people picketing, and that was really hard on the patients. Luckily, we had a back door. So there were some moments I had where I had to walk through the people in the parking lot, which was behind the building, and get them out of our parking lot, which was private property. There was a bombing of the back door, firebomb of our back door.
Really? When did that happen?
Sometime in the 80s. I don't know exactly what the year was.
So that's where somebody throws a bomb and it blows up?
I don't know what they did, but it blew up. I mean, we found the burned back door. We were not there.
Oh, it happened what?
It happened maybe 5 in the morning, when no one was there.
Oh,
thank goodness.
Was there a lot of damage, or do you remember?
There was enough. There was some structural damage, but it didn't stop the services. Like, I think they hoped to stop the service or to scare us into stopping the services.
Right.
It was pretty scary. I mean, it was scary for staff. It was scary for patients. We had to counsel the patients about what was happening with the anti-abortion people, and that was tough. I mean, that was hard, and we had to have meetings about what to say, what to do, so that we were all on the same page and saying the same things to the patients.
Yeah. Did you ever felt like you were personally threatened, or, you know, it seems to me somebody had a campaign where they were publishing names and addresses on the internet somewhere along the line.
Right, and that has happened, but that's more recent. That's since I left. And I don't know that that's actually happened to the Boulder people here, the Boulder staff, but we had hate mail, we had threats, we had hate phone calls.
Was anyone ever caught or prosecuted for any of that? None of it?
No.
Were the
not that I'm
police
aware
ever
of.
called? Or?
Yeah, the police were always called.
Always called.
Whenever we had hate mail, or, well, certainly a bombing, and certainly the picketers. And the police in Boulder are terrific, and have always been pretty supportive. So we're lucky. We live in a community that supports the Women's Health Center, for the most part, even though there are people in the community who are opposed to it. So here it's not that hard to work at a place that does abortions.
Yeah.
But there were times that were very scary, and we had to really figure out, you know, how to be in that. It just made me angry. I mean, it scared me, but it made me angry. I have to say, I was glad that my two daughters had a different last name than mine. I was very happy about that, actually. I mean, I did think about that, and you know, they were in school here. They were young. They were 6 and 4 when the clinic started.
So your daughters grew up in Boulder then?
And they grew up, you know, with the women's clinic.
Yeah. Yeah, so
So
I imagine they
know a
knew.
lot.
They knew.
Yeah,
they
know a
knew the
lot.
score.
They did. They knew a lot by the time they were teenagers.
Yeah.
Yeah, they were
Wow.
highly educated in healthcare.
Were they ever worried about you, or did they ever say, "Mom, don't do this anymore"? Or?
I didn't tell them.
Oh, you didn't.
There was no reason to tell them. They were very young. They were in elementary school, and there was no reason for me to tell them anything scary.
And so you left, when was that again?
1987.
1987? And what happened, what was your adventure after that then?
I went into private practice as a psychotherapist and eventually as a spiritual counselor. I began to lead women's wilderness vision quests, and I still
I'd love to hear a bit about that too.
I still do that. And my worldview expanded during those years. For the last couple of years that I was at the Women's Health Center, my worldview was expanding, my experience on the land, the mountains, and just understanding spiritual connections and what that meant for people, and the dimension of that, and the different cross-cultural teachings about that.
Did something happen specifically, or does this?
My personal life led me in that direction. I mean, I was seeking healing and solutions for myself. I wasn't happy in my personal life at that time in the middle 1980s, and the person that I found to help me out was leading vision quests and groups. Not the traditional Native American vision quest, but more of an adaptation of the wisdom teachings of that, and then bringing it into a kind of modern Western framework. But still going out on the land for a week and then spending 2 days and 2 nights by yourself, and fasting or partially fasting.
Can you describe, I mean, I've actually read your website, so I know what it is about, but can you sort of tell what one of these wilderness
What the trip
retreats?
is?
Yeah.
It's an 8 or 9 day trip into the wilderness. The overall umbrella name of it is Women's Wilderness Quests. And there's a certain kind of preparation time to walk on the land, remember the planet that you live on, remember where you are, and gain that perspective, and then go out and spend time for the first couple of days in circles. And I use music a lot. I'm a trained musician and singer, and so I lead sacred chant, and I do that on the trip. So it's really my program, using the things that I know and the wisdom teachings that I've been lucky enough to stumble upon from Native American people and from my own ancestors and from just whatever I can get my hands on. And the land itself. Because if you go out and spend enough time alone on wild land where you are outnumbered by nature, and you're the human nature, but the rest of nature is there in all its forms, you can't help but notice that there's a lot to learn. And so people have life-changing experiences, because after the first couple of days of preparation, sitting in the circles, they go out by themselves for 3 days and 3 nights. Most of them do fast with water. Some of them will do a partial fast depending on medical conditions or whatever is going on for them. And they'll come back and they'll tell their story, and I will mirror the story, which just means reflecting what it sounds like happened to them in relation to their time with the place on the land where they were. And then they have, usually the vision is, occasionally it can be an actual vision in the traditional sense, but most of the time it's a very important insight that the person will gain from their time alone on the land, and then they will be able to bring that back to their community, to their family, to their own life, and go on. So it can be a really profound experience for people.
Yeah, I can imagine.
And usually it is.
This is, you don't have to answer this if you don't want, but would you say that doing that work is a natural evolution from the years of abortion work, or is it perhaps an escape from the abortion work, or is it the next layer, or I know that's kind of a complicated question, but...
So it sounds like you're asking me what the relationship is between the abortion work and the work I do now.
Yeah.
Well, there's a relationship because it's my experience. That's where the relationship is. I learned to be a counselor by becoming a women's health counselor. I had not been a counselor, and I was not trained in psychology. I was 26 years old when I started working at the New York City clinic, and so I was very young. And I had 3 years of college, and I had taken one psychology class, which I did really badly in because it was a statistics class. It was horrible. And I was a history major. I was interested in people, and I was interested in what happened to people. And the counseling piece came in quickly because I have a natural ability. I'm very, very intuitive, and I didn't think of myself that way particularly, but sure enough, that's what showed up. So when I sat down with a person to talk about her life, it was easy for me, because I just got it. I picked up what was going on, and I could ask all the kinds of questions that would help her get clearer about what was going on for her. And the empowerment piece was there with regard to feminist counseling. It's always about empowerment, helping people to feel more empowered in their lives. So that happened for me, and I was always very curious about why abortion was such a big deal, and why it was such a taboo and such a problem for the country and for the world, as well as for individual people. And what was this history that was behind all that? And there's a very long history that there's no time to go into right now, but that's pretty important in terms of understanding. And so I had a historical perspective. I'd kind of grown up in it because my parents were left-wing people and very history-minded.
But not religious?
Not at all. And I was a history major, and so I had that. And I had some sort of individual spiritual connection, which I believe everybody has, but each person's is different and not necessarily the same as each other person's. And it's not necessarily part of an organized religion. although I find organized religion fascinating. But my own personal evolution just took me in the direction of going from women's experiences with their bodies to, including my own experience with my own body and my own psyche, and my experience of living on the land. I lived up in the mountains for 2.5 years when I first came to Boulder.
Whereabouts was that?
Up on Sugarloaf.
Okay.
Yeah. And Sugarloaf Mountain had an impact on me that I wasn't aware of at the time. But in the middle 1980s, I started doing this pilgrimage kind of back to Sugarloaf Mountain. And it was completely involuntary and really not something I thought about, but I just found myself going back to the mountain and spending a lot of time on the mountain. And at that time I was being exposed to meditation and to chanting and to practices of connecting with the land. And as I did that, and as I was spending more and more time there, I realized I had a spiritual connection with the mountain. And yeah, and it was just beautiful and simple and easy.
This is Carol Turner again. We're interviewing Linda Weber on April 24th, 2013. And this is tape 2, and we were sort of talking about the evolution from working with abortion clients, moving on to a sort of more spiritual life, which is the story of your evolution. And you were just talking a fascinating story about your relationship with Sugarloaf Mountain. And maybe I could start you off again with asking you, was this before or after that fire? Because I remember the fire. When was that fire on Sugarloaf?
It was before the fire.
This is all before the fire, okay.
Yeah, this is before the fire. The fire was in 1989.
Okay, so.
Yeah. Okay, so the relationship between the counseling, it was evolving from abortion counseling and what I call crisis pregnancy counseling is what that really is. Into more sexual counseling, sexuality counseling, relationship counseling. The counseling program at the health center expanded, and we began doing long-term counseling there. Even just actually a year or two before I went into private practice.
Just general counseling more?
General
okay.
counseling. So it was really growing and deepening. And I was growing and deepening, and I was self-educating like crazy. I was going to the mental health center and taking classes at the mental health center that they were giving for practitioners in the community about psychotropic medication, about all kinds of issues in psychology that I needed to learn more about, because like I said, I did not have a degree when I started. I might as well have had a degree by the time I left the clinic, because I learned so much. But anyway, so it was deepening and evolving from there. But in my personal life, the bottom kind of fell out, and I really had to open up to what I call the spiritual dimension, and understand that it was real, and I was real in it, and it was real with me, and begin to explore it. And when that happens to people, there's no choice. You are confronted with a certain level of reality that you might like to deny. I mean, I was pretty much denying it. I thought of myself as an atheist at the time, but the atheist thing didn't work. So I mean, I just found myself learning more and more and more. And when I went into private practice, I realized quickly that I needed to get a degree. And so I applied for the master's program of Vermont College of Norwich University, and they're a Without Walls program. And they, at that time, I don't know if they still do it, but at that time they grandfathered in 2 people per year who did not have a BA. And they were willing to let me go for the master's because I had 18 years of experience and 3 years of college. And so they decided that my 18 years of experience was equal to my last year of college, and they just basically gave me the BA and let me go for the master's. So I did.
When you say no walls, is that like a low residency, or
Well,
what do you mean?
it's no residency.
No residency.
And their instructor, the instructor who was my instructor, was living in California. So it was Vermont College, but it was she was in California, and she would come here, and we would have seminars and all kinds of wonderful programs. And I had to design my own degree in order to be accepted for the program, and the designing of the degree actually took longer than getting the degree, because there was more work involved in figuring out what my readings would be and everything. And I had to put all that together, and then they accepted that and let me do that.
And what does your degree call
The
then?
degree is a master's in psychology and women's studies. It's a joint degree, double degree. And I learned a lot during that time, putting the program together and then actually studying all the material that I said I would study. And so I came into contact with Jungian psychology much more intimately, and of course that has a tremendous, overlap with spirituality and spiritual understandings, and and then I had all my personal stuff was happening, where all these connections were being made. So it just worked for me to embrace more of an understanding in my work with people, and so there's a relationship, because it has to do with my own unfolding, but I can't say that there's an academic relationship necessarily.
Did it feel like an escape from sort of grim, years of abortion counseling, and now you're, away from all this depressing stuff, or did it just feel like an evolution? Or I know this is an important issue with you.
Yeah, it's an important issue. I didn't think abortion counseling was not grim at all. In fact, it was very uplifting and joyous, because the women needed their abortions. They seemed to gain a lot from having the psychological support, the emotional support that we gave them, and they seemed to learn a lot about what was going on for them. And that was a glorious experience for me. I loved being involved in that work, and we were really helping people. So I've never thought of it as grim. I mean, I didn't want to do crisis work anymore. That's where the change really happened in terms of the kind of counseling that I was doing. I was tired of talking with people who were in crisis in their lives. And unwanted pregnancies usually are a crisis for a person in her life. I wanted to do more long-term work. I wanted to do deeper work with people, go a little more slowly. And so that was part of what I wanted to leave. I wanted to leave the crisis stuff behind and go into more of this long-term therapy work where people could explore more deeply, because the time was there. When I did the crisis work, what you do when you're a crisis counselor of any kind is you plant seeds. You say things or you ask questions that from your own experience working with people can be helpful or might be helpful, or you're getting an intuitive sense from whatever the person is saying that asking a certain kind of question is relevant. But all you do is plant seeds, and you never see the flower. You never see what happens, because the person leaves and that's it. You never see them again. Whereas when you do more long-term work, you actually do see the changes that happen for people. So
do you miss the old counseling, or
not really.
you're just
Yeah.
I mean, it sounds actually quite enthralling, the sort of wilderness.
Yeah, the wilderness thing is in the
intimidating.
summertime. The rest of the year, I'm just doing work in my office with people, or I'm helping people go out on sacred walks on the land, and then they'll come back and I'll mirror their story. I do that, and I did. After I left the clinic, when I started the private practice, I did see plenty of women for post-abortion work, more long-term. And this is what relates to the book that I wound up writing.
Let's
Yeah.
talk a little bit about
Because
your book.
what happened was that not only did I know what happened for the women pre-abortion and during their experiences and maybe right after, but I began to learn, find out what the abortion experience meant for certain individuals who came for more long-term counseling to try to resolve conflicts that they had about having an abortion. And so then I began to see that the issue had the kind of positive impact on people's lives that would kind of open up new understandings about who they were as people and what they wanted to do in their own lives, what their life purpose was. So I began, making notes like crazy. I really kept pretty good records. And then I eventually got permission from a lot of these clients to use their stories in the book. And they're all disguised. Their names are changed. There's information that's slightly changed in order to protect confidentiality. But I began to see that there were rituals happening. People were doing ceremony on hillsides to deal with grief that they had about either losing the pregnancies or because they lost the relationship with the man involved. It was their boyfriend or their husband. Usually it was a boyfriend. Husbands usually stuck around. But there was just a great deal of learning for me. And I had always thought that I should write down what I was seeing with people. But I wasn't sure exactly what the book was really going to be.
So it was an exploration, really, of what happened and all your experiences.
Well, they came to me, these clients, and they were not people I'd seen at the clinic. They were people who, I don't know how exactly they came, but they showed up. And one, for example, was a young woman, 18-year-old, who had an abortion in her senior year, or just at the end of her junior year of high school. And she spent the whole senior year in therapy with me and working it out in terms of trying to understand what actually happened. And long story short, what happened is that she had to learn how to separate from her mother emotionally, how to individuate, how to become, a young adult, emphasis on the word adult, from being a child, because her mother had insisted that she make the decision, that the girl make the decision about her abortion. And her mother wouldn't make the decision for her, which made her very angry because she really wanted her mother to make the decision, but then she didn't want her mother to tell her what to do, et cetera, et cetera. And so she had to figure out where she stood and how she felt. And her story is in the book, and I call it a rite of passage, because she really stepped into taking responsibility for her own life by having to make that decision. Very exciting to think about.
So, I've read your book, and I know there was there's a real sense of sort of optimism in the book, as opposed to it being this sort of, horrific, sort of nightmare scenario after nightmare scenario.
Some women still describe their abortion experiences as a nightmare scenario.
Mm-hmm.
Some women still feel like it was, for them, a horrific thing. And for some of them, the experiences were not so good for whatever reasons. But one of the things I do in the book is discuss a number of reasons why an experience might not be so good with a crisis pregnancy and an abortion. And usually it has something to do with the circumstances of the pregnancy or the circumstances of the person's life, in addition to ending the pregnancy. There's still a stigma, there's still a taboo in society here. And if you ask most people, I think they'll, unfortunately, they'll still tell you that an abortion is a bad thing. But it isn't a bad thing. It's actually a very, very good thing. And saves lives It saves women's lives, and it saves some men's lives too. It saves relationships, it saves communities, it saves families. It's a very, very important thing, and it's been with us throughout history. And this is where my history major thing comes in, and I'm very grateful for it.
Do you have a sense of how prevalent illegal abortions were before Roe v. Wade, and what kind of...
I don't have the statistics just on hand, but it was prevalent enough. And of course there was maiming and death, because people would set themselves up to do abortions who were not doctors, and desperate women would go to them and they would die.
And people went to Mexico, I think you mentioned somebody.
People went to Mexico, and some of the Mexican clinics were fine, and some of them were not so good. Because anytime anything is, black market, there are going to be charlatans, and they're going to just be doing it for the money. And so it was very dangerous when it was illegal. But throughout history, it's in many societies been pretty much left up to women as to what happens with pregnancy. And then there have been patriarchal governments throughout history, the last 5,000, 9,000, however many years we want to look at it, that have tried to control it. And that's a whole other discussion in and of itself, which I do talk about in the book to some extent. So it's important to have a historical perspective about it. And then it's also important to have a spiritual perspective about it, because one of the things that I found was the women, many of the women, or a few of the women who I counseled, had what we can call spiritual experiences in relation to their pregnancies that ended with abortion. That would indicate that there is, for a number of people, some kind of soul-to-soul communication that goes on with regard to a soul that might or might not become attached to a full-term pregnancy, baby. And these women do have that negotiation, and when they do have it, they discover that, some of them discovered that the soul was actually coming in to teach them about becoming responsible, autonomous, empowered individuals. That gives me the chills. And when people talk about that, or a woman tells me that she sat in meditation and she saw the essence, the life force leave of the pregnancy, take off like a little blue spark. That's what she saw. And this was not me bringing it up. I did not, because I wasn't that comfortable with spirituality during the years when I started hearing these stories. I learned from the women who told me these stories. And so I put some of those in the book too. And it just became clear that the issue was coming in, and this is my perspective, to teach society and to teach individuals, men and women, how to care consciously, how to be awake and caring in the world, and make the kinds of choices that actually support life in the community, and not to be so stuck on individual life. I mean, individual life is important. It's very important. But the relationships in life are the only thing that make life possible. There's no such thing as abstract life. And I talk about that in the book too. There just is no such thing as abstract life. So when you hear the anti-abortion people talking about life, they're talking about an abstraction. And there is none. Life only exists in relationship. Life only exists when life is nurtured. And if it isn't nurtured, it doesn't exist. And if you look in biology, and I did a little bit of that, and in anthropology, and I did a little bit of that for the book, you find that in all species, there is this back and forth, this in and out, this flow between birth and death. And abortion as an issue and as an experience encapsulates birth and death together. And that's a really tough concept. It's a very hard thing to understand, to be clear about. But my experience is that the women understand. The women throughout history have understood and have taking responsibility in usually a pretty matter-of-fact way about what life to bring through their bodies and what life not to bring through their bodies. And that needs to be respected. So the problem is the lack of respect and the lack of freedom and, you know, the lack of safety. That's the problem in our society and in the world.
Okay, one final question, kind of along these same lines, is your own spiritual blossoming. Would you say that it would have happened whether you had been an abortion counselor or not, or do you think it's really directly, are the seeds of that in those experiences?
Well, you know, the seeds of my own spiritual awakening were there when I was a teenager. They weren't particularly nurtured by anyone, or I wasn't in an environment where I could understand what was going on or be supported particularly, but they were there, and that was going on. And I think that it created a kind of a certain devotion to life and to people. And so, and this is me talking with hindsight, because I didn't use that kind of vocabulary when I was young. And that's what took me into doing work with women and work with women's health and abortion. So there's some kind of relationship there, but I don't know exactly what it is in relation to the abortion work.
I guess that's kind of an impossible question to answer.
Yeah, I don't know for sure.
Yeah.
It all lives inside of me, but I don't know.
Well, you're the common denominator.
Yeah.
So. Okay.
All right.